Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a special guest this evening, Ben Akoa. Ben, please introduce yourself.
Hey, nice to meet all of you. My name is Ben. I'm an administrative fellow at UCHealth in Denver, Colorado. I grew up in Maine and also in Northeast Ohio and Cleveland. And now I've been out here for about a year.
Kind of a great variety of locations,
Oh yeah,
right? That
we're
you've
all
experienced.
over the place, all over the place. We're hitting states everywhere.
It's excellent. I have not been to the Midwest, and so one of the reasons I like doing these interviews is because I get to learn so much about kind of the area I've never been. You started in Maine. You then went and got, I believe, a bachelor's in public health before getting your MHA. What started you off into the healthcare realm?
Yeah, so I was a public health student for undergrad. I was able to work with my health department when I was in high school. So going into undergrad, I really wanted to focus on supporting people in my community. So I was a sociology and public health major, and then before I graduated from undergrad, I worked with my health department, and we were the county that's just west of Cleveland. So I had a lot of great experiences working with not just our health departments, but leaders in the community as well as health systems as well. So going on from that path, I found out a little bit more about the MHA programs and the opportunities to not just work in the preventative side, but also work in the treatment side. So I think one of the great things about being in a health system is that you can do a lot of those public health initiatives as well. So for me, that was one of the biggest things is being able to affect people in more than just one way. So that was really important for me.
Excellent, very nice. And then I noticed on the resume something that was interesting, and it's that construction work that you did during your
Yeah.
undergrad. How did you come across that?
Yeah, so my family, they're contractors. So something that I was really interested in doing early on was going into construction. So when I was a kid, when I was in middle school, when I was in elementary school, I always wanted to be the guy in the crane or be in some of the big lifts. I always thought that was really cool. So for me, it was a way for me to still connect with my family and still work. So I think a lot of my experiences in construction shaped me into who I am, and I'm very fortunate for them.
I'm excited to talk about that too later on, how some of the experiences have shaped you. And so you ended up going to Cornell, right? Which is an Ivy League university. People really like Cornell. And so what was the reason for choosing that school? How did that come up on your radar?
Yeah, so I think one of the biggest things for me was when I was looking for schools, I always wanted to reach out to current students and former students as well. So just through talking to a lot of people that went to the Sloan program, it was a great sense of camaraderie and just friendship. And I think that for me, that was really important because wherever I wanted to go, I wanted to be a contributing member after I graduated and be an alumni that would reach out to students or they would be able to reach out to me and ask any questions. So that's where it started for me. And then one of the big themes that I think when talking to people who go to Sloan is the opportunity to take classes in different colleges outside of what's required for us. So I think that's a really big draw is being able to take classes with the business students, take classes with our labor relations students. You can really take classes anywhere, and they want you to do that. They want you to expand your horizon and healthcare is so intricate and you can learn a lot of things from not just taking those MHA classes. So for me, that was a really big draw was being able to expand just the knowledge that I had. So that was a big thing for me.
Um, yeah, so I guess I'm really intrigued by that because I was not aware of that at all about Cornell. And so, it was that program at Ithaca, or was that in the New York City area?
Yeah, so it's in Ithaca. So all the residential students are in Ithaca, and it's a 2-year program, similar to most MHA structures. And then we also have the executive MHA program as well. So we had some overlap in some classes. I believe it was typically for the EMHAs, they had 5 years of work experience, but they were another great resource. And another draw for me was being able to connect with some of them as well.
And so I guess I'm really interested in that piece of the being able to take courses elsewhere because I assume that that's not that common, right? And for MHA programs, and so how do you feel like that kind of benefited you further? Because it seems like a lot of what you've done has shaped you into being a well-rounded individual. You don't seem like an individual with one, ultra specific focus, right? How did that benefit you long term?
So I think one of the biggest things, especially when just thinking of like the being a well-rounded individual when it comes to what you can bring to your fellowship, your work, consulting, wherever you're in, is you get to work with different people too. I think a big part of grad school is a lot of group projects. So that was a big thing for me too, is knowing that I'll be in big group projects and students that are outside my program. I think if I had any advice for anyone going back to an MHA program is trying to work with students who are in other majors. If it's
Mhm.
MPHs, if it's MPAs, I think you could definitely learn a lot. And I think we have a lot of overlap in our careers. So I think that was a big thing for me. I wish I maybe took more of an advantage of that. But yeah, it's a great opportunity, I think.
Appreciate you sharing that. That's very good advice, and it's something that I've been trying to seek out as well. So I do encourage it. I recently worked with somebody who's majoring in a cannabis business.
Mhm.
That's what our university offers, and so being able to work with
Yeah,
them and hear their ideas that
yeah,
I never would have been exposed to otherwise was very great. So I appreciate you sharing that.
yeah, of
And
course.
and then during the program, right, you had the internship opportunity, and you went to kind of another large name institution, Cleveland Clinic, for that internship. Of course, back in Ohio, where you're
Yeah.
familiar with. So, how did you end up going to Cleveland Clinic? Was that something that you targeted?
Yeah, it was something that I targeted. Being from Cleveland, it was a really unique opportunity. I was a patient of Cleveland Clinic, so the chance to be able to go back and help support people in the community and learn more about just how they became such a great organization, how they still are able to affect so many lives, and not just Northeast Ohio, but across the country. So for me, it was a big thing to be able to come back again to my community that I lived in, and even during my previous internship for my health department, we had some overlap with Cleveland Clinic, whether it was smaller counties that would meet or cities that would meet. They'd bring leaders. So they would bring a leader from the president of Avon, the Cleveland Clinic Avon Hospital. So I was able to meet her when I was, maybe when I was a senior or a junior. So that was a unique opportunity. So I think anytime I think you get the chance to go back and serve the people that are where you're from is a really great opportunity. So that was important for me.
How did the applications for the internship compare with the applications for the fellowship? Was it equally as challenging, less challenging?
I would say challenging in their own ways. I would say that maybe fellowships are a little bit more challenging because of the it's more time intensive, but I think intensive. But I think one of the challenging things about the internship process is it's right as you start your program.
Mm.
You're really interviewing and looking at places your first 2 months. So I
Oh,
think
wow.
trying to understand what part of healthcare you want to be in, whether it's a hospital, whether it's for a tech company, whether it's for a pharma company. I think that's one of the most challenging things. So I think whenever I just think about looking back about what the interview process was like, an application process, I think the biggest challenge is trying to figure out where you want to be, but then also remember it's only going to be 12 weeks, but
Hmm.
you've also have only been at school for a month or two. So I think it's juggling with things outside of just that make it challenging compared to the fellowship where you've at least at a minimum had that first year, the people that you go to school with, you hopefully by then have a good friend base and people that can support you that understand what it's like to apply to a fellowship, etc. And then you get at least that 10 to 12 week internship that allows you to see a little bit more of your health, a health system at least, or wherever you end up doing an internship. So I think differences in that aspect, but then the fellowship applications are a little bit more, it takes a little bit more time.
Kind of flows into my next question in terms of knowing where you wanted to be in healthcare. We've seen a trend where a lot of students from some of the top MHA programs, GWU, Johns Hopkins, Cornell, they go into industry, they go into consulting instead of doing a fellowship. They find some great success there. Why did you not do that? Why were you drawn to kind of the community health, working, really trying to bolster these communities and then end up doing the fellowship? How did you discover that?
Yeah, so I think it all starts back with I think we all are focused on our why and why we get into healthcare and why we work with hospitals. And I think for me, going back to working at a health department, I think it's really unique to understand the needs of a smaller community or a bigger community and just the ways that you're able to affect them. So for me, I wanted to work for a health system that had a smaller community hospital and multiple ones in different areas. And I think what's unique about Denver and Colorado in general is that we have a really large growing population of young people. So it's really interesting to see how, and older people as well, at different ages, really. So it's really unique to be in a community that's growing, um, especially in this setting. So that was the big thing for me is kind of going back to being in public health and being in a health department in a smaller setting, and then taking what I learned, maybe parts of that, combining with my MHA, and then bringing that to a community hospital.
How many fellowships did apply for initially?
I want to say I applied for 10. It was somewhere around 8 or 10 was like what I applied for. I think that was like a sweet spot. I think it can be a little challenging doing more than that. I think when you're able to do 8 to 10, you're really able to dive in and learn more about organizations. I think I was just getting to learn more about just the different fellows who finished or the ones that were currently going through the fellowship process. So
Hmm.
um, yeah, that was really important for me, I think.
How I guess it's interesting because you had a good application, right? So you had a lot of choices that you were able to do. You also had this kind of unique aspect where you'd been on the East Coast, you'd been in the Midwest, so you had a lot of opportunities geographically. How did you go about ranking these fellowships? That's something that I know a lot of students struggle with.
Yeah, I think one of the biggest things is just trying to understand um, just where that health system is going, maybe what their needs are. I think a big thing for me was knowing that when I applied for UC Health, UC Health is a young organization. It's 12 years old, but it's also the largest health system in Colorado. And I knew that being somewhere where there's a new health system that's really unique. So for me, I ranked that up very high just because it's a unique opportunity. I think there's a lot of great health systems, like for example, UC San Francisco has a children's hospital and they have an adult hospital. So doing a fellowship there is really unique where you could have the opportunity to work at both. So I think it's those opportunities like that that make fellowships different from others is something that I think is really important when it comes to ranking them. And then above everything else is making sure that the people that you're meeting and that you're talking to, those are people that you can see as your support system and people that you think will really support you and where you want to go throughout your career.
Very good advice. Thank you for sharing that. And you, of course, ended up going with UC Health. You've been there for quite a while, I think, right? You're nearing the end of your fellowship.
Yeah, yeah. I'm nearing the end. I've been here for a little over a year, so it's been quite a bit of time now.
What is that fellowship like? Is it is it rotational based, project based, a mix of both?
Yeah, so it's a mix of both. So during my time as a fellow, I was at one of our rotation based fellowships. So that was important for me. I think during my internship, I was only in imaging. So I really wanted to be able to learn more about the other aspects of the hospital and pattern that was structured. So knowing that I could go see ortho, I could go see work with nursing, I could work with strategy and work with these other areas. I think that was really important for me. So I have a rotation based structure. That was something that I wanted. And some of our other locations were project and rotation based. Going forward to next year, we're doing a mix of both rotations and projects based on what your experience is. And then the second year is comprised of an interim role. So we're really excited to roll out that new structure, and we're pushing all of our flyers out right now and talking to schools. So it's been great.
That's awesome. Were you involved in creating that new way of doing things?
Yeah, so me and my co-fellows, and we have some other folks that are interested, people that really want to grow the fellowship and grow leaders. So it was really unique being able to see those changes. We have a lot of great preceptors. I would say there was a group of at least 6, 7, or 8 people that were able to work on this. It's a lot of work, but it's for a good cause. And I think when you have people that are passionate about it, you know that any change that happens is for the growth of people and because it won't benefit me, but I know it's going to benefit someone else after me. So that was kind of the mentality that we have is that whatever change we do, it's for the betterment of our fellowship and then the leaders that we hope to produce moving forward.
Absolutely. And how many co-fellows do you have in your year?
Yeah, so I have four other co-fellows. We have there's three other fellows in Denver, and then we have one in Fort Collins, and then we also have a fellowship in the southern region, which is in Colorado Springs. So we have a pretty big group, and I think something else that's really important, I think, is for those that do want to have an automatic group of people that you can always just find some type of friendship or whatever you really need. I think going to a cohort model is a great opportunity for that.
Yeah, I know that I've seen that some individuals have enjoyed kind of the solitary
Mhm.
fellowships because it provides such huge amounts of work and opportunity. But I do
Yeah,
know that a lot of people have really enjoyed having 4, 8, 10 fellows across some of these really large systems. And so I appreciate you sharing that as well because that's the thing to note, right? When you're applying,
yeah.
did you factor that into your applications when you're looking at different programs?
Yeah, I think most of the fellowships I applied to, they had cohorts. And I think, one of the great things about a fellowship is you're able to grow your network. And I think, especially for the fellowships, that you're able to get projects in different areas from your co fellows. I think you can kind of have that mentality of there is an abundance of work. There's no fighting for projects or anything. So for us, especially, I think we're all in different hospitals, different regions. So it's never competition. It's always the mindset of there's an abundance of things that we can do. And I think for me, that was also really important.
That's a good way to structure it. You get to have that collaboration, but also enough separation where you're
Yeah.
not. Yeah. And so I think on that note as well, what are some of these outcomes like? Because it's a new health system. And
Yeah.
so some of what people are concerned with some of the new systems is that
Mhm.
they don't know how to have a fellowship,
Yeah.
right? They treat them like an intern or
Yeah.
whatnot. So how is it established there?
So I think one of the big things that we did going into our fellowship was even before I got there, I would say in January, we started having conversations of what I wanted my rotation structure to be like. And I think that really helped me understand the layout of the organization and where there's opportunities for me to grow and where there's growth even within the hospital or surgery center, whatever may pop up. So starting in January, we talked about, this is a proposed schedule of what you could be doing. How do you feel about this? Where are your interests? And then where can we change things to make sure they're aligned with where you want to be in your career? I think that was a really big thing. And then again, I had a lot of great former fellows that were before me that I could really lean on for support. And I still do to this day. I work with a lot of them still. So I think being able to be in a place that's thoughtful about where you're going to be um, and placing you in those positions where you're going to be forced to grow, but also be where the growth is at, because a lot of times those things do overlap. I think that was an important thing for us, is that we try to be as intentional as possible about where we place people and the projects that we give them. We have a charter of projects that you get. So if you were my director and you want to, or a director and you want to propose a project, you would have to fill out a form, and then we take that form, we take it to our preceptor, we get approval, and then we discuss the plans for if a project goes X amount of time. Is there someone else that will take it on, or will you be the one that still stays on it? So I think doing those small things, I think, really just gives you that structure of I know what to expect and I know what others will expect of me.
I know that you're proud of everything that you've done there, of course, but is there
Yeah.
anything that you're especially proud of or that you really like to talk about that you've done?
Um, if there's anything that I would say, a really unique opportunity that I had was in the middle of my fellowship. We brought on a new anesthesia group, and that was a really unique um, time frame for us. There was a lot of legislations going on in Colorado with the attorney general. They were disbanding some anesthesia groups, so there was a lot of change going on in the environment. So I think being able to help project manage the transition plans of we're getting a new group. These are the groups that we're reaching out to see if they're interested. We had local and national groups. We got to interview them. Actually, starting July 1st, that one of the new groups started at Surgery Center, and then our next group will start October 1st. So being one of the liaisons that supports the hospital, the physicians, the nurses, our CRNA, supporting a lot of people, I think is unique to learn the pain points of each group, because everyone's very different. The orthos needs are very different than the needs of our OB group, the needs of um, or spine surgeons, the needs of so many different areas. So I think that was a project that I was fortunate enough to get at a good point in my fellowship, and yeah, I'm very grateful for that opportunity.
Must be great to see it come to fruition with them joining in July.
Yeah, yeah, it was pretty cool. It's been a week now, and then now we're transitioning over to our hospital and making that really our main focus. So we try to make sure that the new group can be as available as possible before we start. That's October 1st start, and making sure we have all the touch points, all the questions that they may have are there, and we were able to bring them in. So we had a lot of town halls. We had a lot of they would bring breakfast to the staff early on in the morning before they would go off to the ORs, and they would meet them that way. So it was a really unique opportunity.
So, kind of one of the last questions here. What do
Yeah.
you think the future holds for you? What are the areas that you're really looking into?
Yeah, I'm really looking into working with different service lines, and I also really like support services. I think those are some of the main things that, of course, they keep the hospital running, but I think support services is kind of behind the scenes at times. So that's something that I think I'd really like to just learn more about, and continue to maybe grow my learning of what it's like to work in support services. So I think that's big for me, and I'm really interested in the changes that will be happening for ASCs and the shift from inpatient to outpatient settings, and those are the two things that I really think will be in my sights hopefully in the future.
Oh, nice, very cool. And can you just give us a brief rundown of what support services are?
Yeah, so we like to think of support services as all those non-clinical aspects of the hospital. So that could be the EVS team, that's food nutrition, that's vending, that's your contractors, parking. Hospitals that are involved in sustainability, typically that could be under that umbrella. But really, the non-clinical aspects that really keep the hospital running behind the scenes.
Excellent. I've heard that quite a few of those are quite complicated, from what I've understood.
Oh, yeah, yeah. They do a lot of great work, and it's really important to have good people, I think, as those frontline staff for support services, because at the end of the day, without cleaning the hospital, providing food for not just the patients but also the staff, I think it's a really key part of keeping a hospital running in good shape.
Really appreciate you giving us that great rundown of the fellowship
Yeah.
and kind of answering all those questions. How does your previous experiences, right, especially thinking back to the experiences of working in construction, how do you find that useful in your kind of day-to-day work?
Yeah, I think something that's really important, especially in healthcare, is that when you're working with people from all kinds of different walks of life, different ages, from different places, I think knowing how to meet people where they are, I think that's something that's really important. For me, when I was an undergrad, I worked in construction. I got to meet and work with a lot of different people, and I think that's something that I always thought of as being thoughtful in how I communicate to them, making sure I'm effective in how I communicate to them, and trying to meet them where you are. I think something might make sense to me, but maybe it doesn't make sense to you. So making sure that I can really get to where I need to be, and making sure you understand why I would ask a question or why I would do something. I think, especially in healthcare, when we're making a lot of big changes, making sure people understand why we do things is always important. And I think leading with your why is something that we always try to do at UC Health whenever we make decisions. Is um, do things first for the patient, and then make sure that people know why we make these changes.
Hmm. Very good. Thank you so much for that advice, Ben, and sharing everything. I hope that we can have you back on as you become,
Absolutely.
an EVS leader or,
Yeah.
whatnot. So thank you so much for coming on.
Yeah, absolutely. And I appreciate you having me.